Welcome to Moving to Portugal Daily, episode 102. I'm Mateus Costa. Today, we cover how to use Portugal's public SNS and private health insurance to secure your visa, exact euro numbers, timing traps to avoid, and a step-by-step 30 to 90-day playbook you can follow. This is a practical numbers-first episode with real examples for a single adult, a family of 3, and a retiee moving to Lisbon, Porto, or the Algarve.
Hook, quick Portugal update, and why healthcare details decide visa outcomes more often than people expect. In 2026, CEF has tightened language around continuous coverage and the acceptable proof of access to care. That means insurance paperwork, the wording, dates, and country coverage lines is becoming as important as your income proof. Most applicants fail for paperwork detail, not for lack of funds. If you get this wrong, you can face a months-long rejection loop, extra costs, and stress you don't need.
Promise. In the next 9 minutes, I'll give you exact euro numbers for private premiums and likely first-year outlays, 3 clear examples with totals for Lisbon, Porto, and the Algarve, the 3 CEF traps that trigger rejections, and a concrete 30, 60, 90-day checklist you can use to lock coverage and submit a strong application. By the end, you'll know which coverage combo fits your profile and what documents to request from insurers so CEF accepts them the first time. Section 1. How Portugal's SNS works for residents. Registration, timing, typical wait times, and what counts as proof of access for residency. First, the SNS is Portugal's national health service. As a resident, you can register with a Centro de Saúde and receive a user number. Registration requires proof of residence or a residence address, an identification document, and, in many cases, evidence of Social Security or a tax number later on. Typical wait to get a primary care assignment varies. In urban areas like Lisbon, expect 2 to 8 weeks to be assigned a doctor. In smaller towns, it can be faster or slightly slower depending on demand. Crucial point. SNS access alone is not reliable proof for initial visa grant unless you can document timely registration and continuous access. For D7 and many Nomad applications, CEF expects an immediate, verifiable healthcare plan starting on or before your residence start date. That's where private insurance or a combined plan becomes essential. You should be doing SNS registration in parallel, not as a substitution for insurer documentation. What counts as proof? A dated SNS registration confirmation, an email or stamped receipt from the Centro de Saúde assigning you to a doctor, and appointment confirmations showing you attempted to register. For many applicants, I recommend including both, an insurer's CEF-friendly policy statement and your SNS registration confirmation. That double evidence closes most CEF questions. Section 2. Private insurance breakdown with real euro numbers and regional differences. I asked 3 insurers for current 2026 quotes, and here are representative figures you can expect when purchasing in Portugal from local or EU-based insurers that CEF accepts. All numbers are monthly and in euros. Single adult. Standard international plan with hospital and outpatient coverage. Lisbon, 42 to 65 euros per month. Porto, 38 to 60 euros. Algarve, 45 to 70 euros. Family of 3, 2 adults, 1 child, similar coverage. Lisbon, 130 to 200 euros per month. Porto, 120 to 185. Algarve, 140 to 220. Retiree 65 plus, comprehensive plan with lower caps and higher premiums. Lisbon, 160 to 260 euros. Porto, 150 to 245. Algarve, 170 to 280 euros. Common deductible ranges, 0 euros in premium plans, 100 to 300 euros for mid-tier plans, and 500 plus for budget options. Expect outpatient copays around 15 to 30 euros per consult on mid-tier plans. First-year outlay example totals, conservative with a 20% contingency. Single adult in Lisbon. Insurance premiums, 600 to 900 euros first year, plus initial GP visits and registration costs, 150 euros. Budget to plan, 900 to 1300 euros. Family of 3 in Porto. Premiums, 1600 to 2400 euros first year. Add dental and prescriptions, 300 euros. Total, 1900 to 2900 euros.
Retiree in Algarve. Premiums 2,000 to 3,300 euros first year. Add higher outpatient usage estimate 600 euros. Total 2,600 to 3,900 euros. These are realistic budget lines to include on your application.
Tip: local Portuguese providers sometimes offer slightly lower premiums but shorter international portability. EU-based insurers usually provide clear CEF wording. Always ask for a CEF-friendly policy statement. More on that next. Section 3. What most people miss and the 3 wording traps that cause CEF rejections. Trap 1. Ambiguous country wording. Policies that say worldwide except certain countries or use vague language like primary country of residence applies can be rejected. CEF wants an explicit line that the policy covers healthcare in Portugal from day one. Trap 2. Waiting periods. Many plans have 30, 60, or 90-day waiting periods for certain services. CEF sees those gaps as lack of continuous coverage. Trap 3. Lack of named insured or family member details. Your insurer must list each covered person by name and include policy effective and expiry dates. How to fix it? Request a CEF-friendly policy statement from the insurer that explicitly states, "This policy provides healthcare coverage in Portugal for named insureds from DD/MM/YYYY to DD/MM/YYYY with no waiting period for emergency or primary care services." Include insurer contact details and a policy number. If the insurer refuses standard wording, get an email from their legal or underwriting team. CEF reviews specific language. A short, explicit statement avoids back and forth. Step-by-step action items and a 30, 60, 90-day checklist you can follow. Day 0 to 30. Select 2 insurer quotes. Purchase the policy with the earliest effective date that covers Portugal and request the CEF-friendly policy statement in writing. Simultaneously, start SNS registration. Book an appointment or walk into your local Centro de Saúde. Get a dated registration receipt and keep any confirmation emails. Day 31 to 60. Consolidate documents. Insurer policy statement, insurer contact card, SNS registration proof, and appointment confirmations. Translate any non-English documents into Portuguese or certified English and notarize where CEF requires it. Day 61 to 90. Finalize your visa submission with copies of all dated receipts and a short affidavit that ties coverage dates to your residence start date. Sample affidavit line. I, Schneem, confirm that I have continuous health coverage in Portugal from DD/MM/YYYY provided by insurer name, policy number, Schneem, and that I have submitted SNS registration confirmation dated DD/MM/YYYY. A few practical notes. Keep everything dated. CEF reads dates first. Keep digital and physical copies. If you change insurers after arrival, keep overlap for at least 7 days so there is no gap. If you're a digital nomad, ensure your plan covers telemedicine and primary care in Portugal, as some nomad plans exclude local GP access. Recap and quick math. 3 scenario totals and recommended combos. Single adult, mid-tier private plan plus SNS registration, budget 900 to 1,300 euros first year. This is the best balance for nomads who want CEF-friendly proof. Family of 3, mid to premium family plan plus SNS, budget 1,900 to 2,900 euros first year. Retiree, comprehensive plan plus SNS, budget 2,600 to 3,900 euros first year. If your budget allows, choose a plan with no waiting periods and named insured wording. It reduces application risk and often costs less than the time and expense of a rejected application. Call to action and resources. If you want a ready-made pack, I created a healthcare checklist and sample CEF-friendly wording that you can download in the Moving to Portugal toolkit. The course includes vetted insurer contacts, spreadsheet templates for comparing quotes, and sample affidavits you can copy. If you act now, follow the 30, 60, 90 checklist in the toolkit and bring the insurer's CEF statement to your application. It cuts rejection risk dramatically. Let's run the numbers and make your move to Portugal.
That's your clear action plan for today. Apply it and move closer to your Portugal life. If you found this useful, grab the healthcare checklist in the Moving to Portugal toolkit and subscribe for daily episodes with practical, up-to-date guidance. Bom dia from Portugal. I'll be back tomorrow with another practical step for your move. That's your clear action plan for today. Apply it
and move closer to your Portugal life.